What happens when four armed men storm an emergency room for one patient, and the only person standing between them and a massacre is the quiet night nurse they never bothered to fear? At 3:08 in the morning, Mercy Ridge Medical Center was running on bad coffee, tired hands, and the soft hum of machines keeping strangers alive. A father held his sleeping child in the waiting room. A truck driver bled through a towel. Behind the triage desk, Natalie Reed checked vitals like it was any other night. Then the doors opened. Rifles, boots, rain on the floor, a shot into the ceiling. They came looking for a wounded man in Trauma Bay 2. But before this night ends, secrets buried in war medicine and betrayal will surface. Stay with this story until the end. Like the video and comment where you're watching from. The shot into the ceiling lasted less than a second, but Mercy Ridge had been breaking long before the men walked through its doors. 3 hours earlier, the emergency room looked almost ordinary. That was the trick of places like Mercy Ridge Medical Center. From the outside, it seemed solid. Brick walls, blue signs, automatic doors, ambulance bay lights cutting through the mountain rain. A building made for rescue. A building people trusted because they had to. Inside, it was held together by tired nurses' delayed lab results, old wiring, short tempers, and coffee that tasted like it had been brewed through a paper bag. Ravenport, West Virginia, slept uneasily around it. The city sat in a valley where the Kanawha River bent like a dark ribbon under rusted bridges and low clouds. In daylight, Ravenport tried to look reborn. There were new murals on old factory walls, a riverfront park with benches no one used after sunset, and a medical tech campus that promised jobs in clean glass buildings. But at night, the city remembered what it had been. Shuttered machine shops, empty lots, trailer homes tucked behind gas stations, coal roads vanishing into black hills. Mercy Ridge stood on the south edge of town, close enough to the interstate to catch wrecks, overdoses, heart attacks, domestic fights, and everything else that arrived after midnight when people had run out of options. By 12:21 a.m., the waiting room was quiet in the way only an emergency room could be quiet. Not peaceful, never peaceful, just waiting. A father sat near the vending machines with a little girl asleep against his chest, her breath wet and uneven. An elderly woman in a church coat held a plastic basin in both hands and stared at the floor as if she were trying not to leave her body. A truck driver with a bandaged hand kept checking the clock. Somewhere behind the double doors, a man with kidney stones cursed God morphine and the entire nursing profession. At the triage desk, Natalie Reed listened to all of it without seeming to listen. She was 32, medium height, with dark blonde hair pulled into a knot that had started neat at 7 p.m. and surrendered around midnight. Her navy scrubs had a bleach stain near the left pocket. Her shoes were practical ugly and expensive enough that only another nurse would understand why. A penlight was clipped to her collar. 2 pens were tucked behind her badge. One worked. She looked tired, but not fragile. That difference mattered, although most people missed it. Natalie wrapped a blood pressure cuff around the truck driver's arm and watched his face instead of the machine. "You said it happened at the loading dock," she asked. "Yeah," he said. Pallet slipped. Caught my hand against the lift gate. "Any dizziness?" "No." "Chest pain?" "No." "Did you drive yourself here?" He looked away for half a second. Natalie tightened the cuff. "You drove one-handed through the mountain road in this rain with an open hand injury?" The truck driver sighed. "I didn't want to call anybody. People say that right before they make things worse." The cuff inflated. He winced. She glanced at the monitor. His pressure was high, but his skin color told her more. Pain, adrenaline, blood loss, not severe. No shock. Not yet. "You are going to need imaging and probably stitches," she said. "Keep the towel elevated. If your fingers get cold or numb, tell me immediately." "Yes, ma'am." He smiled a little when he said it, like he was making a joke. Natalie did not smile back, but her voice softened. "I mean it. Immediately." He nodded because people usually did when Natalie used that tone. Not loud, not sharp, just steady enough to make panic feel unnecessary. Across the desk, Tyler Boone fumbled with a stack of intake forms and dropped half of them on the floor. "Sorry," he muttered. Natalie bent and gathered the papers before he could scramble for them. Tyler was 23, tall, thin, and knew enough to still believe the hospital had a correct way of doing things. He had been an orderly for 3 months. He wore his ID badge too high, apologized too often, and looked at every trauma call as if his soul had to catch up with his body. "You doing all right?" Natalie asked. Yes. Just tired." "That is allowed." He gave a nervous laugh. "Feels like it isn't." "Then you're learning." Tyler looked toward the double doors where a patient had started shouting again. "Does it ever stop feeling like the whole place is one mistake away from falling apart?" Natalie placed the intake forms in order and tapped the stack straight with 2 fingers. "No." Tyler stared at her. She looked up. "But you get better at seeing which mistake matters first." He nodded slowly as if she had handed him something useful and heavy. The doors behind triage opened and Dr. Samuel Pike came through with a tablet in one hand and a paper cup in the other. He was 49, tall silver at the temples, and handsome in the way some doctors remained handsome by assuming the world had agreed to it. He had the clipped walk of a man who had been excellent for long enough that correction felt like insult. "Natalie," he said without looking up from the tablet. "Bay 3 is still waiting on labs. Lab said chemistry is backed up. I called twice. Call again." "I did. Then call better." Tyler went very still. Natalie's expression did not change. "Bay 3's lactate came back 5 minutes ago," she said. "It is elevated. I flagged it in the chart and sent it to your queue." Pike stopped walking. He looked down at the tablet, thumbed the screen, and found the result. A small muscle moved in his jaw. "Fine," he said. "Then why was I not verbally notified?" "You were in Bay 6 reducing a shoulder. You could have interrupted. You told me not to interrupt a procedure unless someone was actively dying." Pike looked at her then. Natalie held his gaze without challenge and without apology. It had taken her almost a year to learn that the safest way to deal with Samuel Pike was to give him facts and leave no emotional surface for him to grip. He sipped his coffee. "Bay 3 may be septic," he said. "Yes, I'll reassess." "Good." Pike walked away. Tyler exhaled after he was gone. "He talks to everyone like that?" "No," Natalie said. "Sometimes he is worse." Tyler almost smiled. At the nurse's station, Denise Mallory sat with a headset on one hand on the phone and the other filling out a staffing form she had already complained about 6 times that night. Denise was 54, broad-shouldered, sharp-eyed, and built from the kind of patients that had burned down into steel. She had worked at Mercy Ridge for 19 years. Administrators feared her because she remembered every promise they had ever made and every budget cut they had tried to disguise as innovation. She covered the mouthpiece and called across the desk. "Reed, did Pike just discover sepsis after you put it in his chart?" Natalie cleaned the pulse oximeter with an alcohol wipe. "He found it eventually." Denise snorted and returned to the call. "No, Mr. Keene. I understand what the staffing model says. I am telling you the staffing model does not know how many people are vomiting in my hallway." Natalie glanced over. Denise listened, then closed her eyes. "With respect, sir, if you want us to reduce wait times, you can send us nurses or a miracle. I will accept either." She hung up harder than necessary. "Martin Keene?" Natalie asked. "The one and only." Tyler lowered his voice. "Hospital operations?" Denise looked at him. "Baby," He is not operations. He is a spreadsheet with teeth. Natalie turned back to the waiting room, but she kept one ear on Denise. Everyone did. In night shift culture, information traveled through tone before words. What did he want? Natalie asked. Updated compliance numbers before morning. At 1 a.m, he says the board wants active data. The board is asleep. Martin Keene does not believe in sleep. He believes in metrics liability and finding new ways to make fewer people do more work while calling it improved workflow. Natalie said nothing, but her eyes moved toward the security camera in the corner. The small red light blinked steadily. 4 months earlier, Keene had announced a performance review process for overnight staff. He had stood in the staff room in a charcoal suit and told nurses who had not sat down in 9 hours that Mercy Ridge needed to become more efficient. He had used gentle words: optimization, flexibility, resource alignment. Natalie had watched the slide deck and realized the scoring system punished the oldest nurses, the most expensive nurses, and the nurses most likely to slow down unsafe discharges. Afterward, she had asked him whether patient outcomes were weighted. Keene had smiled. Of course, he had said. Then he had turned away before explaining how. Natalie had learned to distrust men who smiled before answering. At 1:03 a.m., the ambulance radio crackled. Denise reached for it. Mercy Ridge, go ahead. The paramedic's voice came through rough understatic. Inbound with adult male gunshot wound to lower abdomen, intubated pressure, soft police hold. ETA 6 minutes. The room changed. Not dramatically. Not for patients. The father near the vending machine still held his child. The truck driver still bled into a towel. The old woman still stared into her basin. But behind the desk, every trained body shifted. Natalie moved first. Trauma 2, she said. Denise was already standing. Tyler, clear the hall. Tell radiology we may need portable imaging. Pike. Pike appeared from Bay 3. I heard. Natalie pulled gloves from the box and checked the trauma bay as she entered. Suction. Airway tray. Chest tube setup. Blood warmer. Trauma shears. Extra gauze. She moved through the checklist with quiet speed, touching each item once. Tyler hovered near the doorway. What do you need me to do? Nothing unless I ask. Watch where people stand. Do not block the foot of the bed. If you feel like you are going to faint, sit down before you fall into something sterile. He swallowed. Got it. The ambulance doors opened to rain and red light. They rolled the patient in fast. Male, mid-40s, gray skin, blood dark across the sheets. The paramedic at the head of the stretcher squeezed the bag valve with one hand and gave report as they moved. Jonah Vale. Found in an alley behind East Mercer. Single gunshot wound, lower abdomen. Exit not confirmed. Intubated in the field. 2 large bore IVs fluids running. Pressure 80/40 palpated, came up briefly, now dropping again. Local PD requested hold. Evidence bag secured. Officer Ben Harlan came in behind them, rain dripping from the brim of his hat. He was young for a patrol officer, maybe late 20s, with tired eyes and a red mark across his cheek where his radio mic had pressed during a long shift. I am supposed to stay with him, Harlan said. You can stand outside the bay, Denise told him. Not inside unless Dr. Pike clears it. Harlan looked relieved to be told where to go. Natalie watched the transfer from stretcher to bed. 1, 2, 3. Jonah Vale's body shifted onto the trauma mattress. His blood pressure dipped. The monitor protested. Pike took the head. Airway secure. Natalie pressure. 78/42. Blood. Already called. Pike glanced at her, then back at the patient. The wound was ugly, but controlled enough to suggest someone had done quick field work before EMS arrived. Natalie cut away the remaining fabric. Jonah had a scar near his left ribs, old surgical. Another on his forearm, thin and pale. His hands were calloused in a way that did not match an office worker. Not random. She looked at his face, sedated, unconscious. A stranger, and yet the air around him had weight. Officer Harlan stood outside the glass, one hand resting near his holster, trying to look more awake than he was. "Where are the detectives?" Natalie asked Denise quietly. "On their way. Federal." Denise glanced at the chart. "Notification pending. Pending means nobody is coming yet." Denise gave her a look. Natalie did not explain. She did not need to. Mercy Ridge saw plenty of gunshot wounds. Most came with noise. Family in the hallway. Police asking questions. Detectives leaning on counters. Someone angry. Someone crying. Someone demanding answers before the blood had dried. Jonah Vale arrived with a police hold and evidence bag and silence. That kind of silence had structure. Pike stabilized him enough for surgery consult, then transport was delayed because Vascular was tied up at another facility and the weather had grounded one helicopter. Mercy Ridge did what Mercy Ridge always did. It improvised under pressure and pretended improvisation was policy. By 1:48 a.m., Jonah Vale was still in trauma bay. 2 sedated, ventilated, guarded by 1 exhausted local officer. Natalie stepped out to the corridor and found Martin Keene standing near the administrative hallway. He was not supposed to be there. Keene wore a dark overcoat over a pale blue shirt. No tie. His hair was perfect despite the rain. He held his phone face down in one hand. People like Keene rarely held phones that way unless they did not want the screen seen. "Natalie," he said. "Mr. Keene." His eyes moved past her to trauma bay 2. "Busy night. Normal for us. I heard there was a police hold. Gunshot wound. Yes. Unfortunate." His face did not match the word. Natalie stepped slightly to block his view of the trauma bay. "Is there something you need from the ER, just checking operational flow?" "At 2 in the morning. The hospital never closes. Administration usually does." His smile appeared thin and practiced. "You have always had a direct way of speaking. I work triage." "That explains it. It rewards it." Keene looked at her for a moment longer than necessary. "You listed prior military service on your hiring file, didn't you?" Natalie felt nothing move in her face. That was not natural. That was practice. A lot of people have prior service. "I suppose they do." "Is that part of operational flow?" His smile did not reach his eyes. "No, just curiosity." Natalie let the silence sit. Keene broke it first. "Well, try to keep the night quiet." He walked away down the administrative corridor. Natalie watched him pass beneath the exit sign. He turned left toward offices that should have been empty. Behind her, Officer Harlan shifted his weight and rubbed one eye with the heel of his hand. "You okay?" Natalie asked him. Harlan straightened. "Yes, ma'am." "You eaten?" He blinked as if the question surprised him. "Not since dinner." She went to the nutrition fridge, took out a turkey sandwich, and handed it to him. "Eat half. Not where the patient can see if he wakes up." He looked at the sandwich, then at her. "Is that allowed?" "No." He accepted it. "Thanks. What did they tell you about him?" Harlan glanced toward Jonah. "Vale." "Not much. Picked him up after EMS called it in. Sergeant said stay with him until relieved." Relieved by who didn't say. Natalie looked down the corridor. The lights hummed. Rain tapped the ambulance bay windows. "Call your sergeant," she said. "Ask when another officer is coming." Harlan hesitated. "You think I need one? I think a police hold means someone wants him held. That usually means someone else might want him loose." Harlan's face sobered. "Yes, ma'am." He stepped away and made the call. Natalie returned to triage, but the rhythm of the room had changed for her. The father with the child, the truck driver, the old woman, Tyler restocking gloves, Denise arguing with bed management, Pike snapping orders in Bay 3, all ordinary pieces, all fragile. Her mind began doing something she had spent years trying to stop. It built a perimeter. Entrances, exits, Sightlines, blind corners, doors that locked, doors that stuck. Staff who could run, patients who could not. Security response time, police distance, weather, visibility, the thin glass between the waiting room and the outside world. She forced her hands to slow as she cleaned the triage counter. Not here, she told herself. That life was over. Her name was Natalie Reed. Her nursing license said Reed. Her apartment lease said Reed. Her mother's old Bible, still in a box in her closet, had Reed written inside the cover. Cross belonged to another life, another country, another woman who had knelt in dirt with blood up to her wrists while men screamed for medics through smoke. That woman had been useful. That woman had also been exhausted beyond language. Natalie had left the army with a sealed file, a duffel bag, and an ache under her ribs that no scan would ever find. A JAG officer named Miriam Velez had helped her restore her mother's surname. Not hide, exactly. Nothing legal was hidden. But she had stepped away from the name the Army had used to turn her into a line in restricted reports. Sergeant First Class Natalie Cross. She had packed that name like contaminated gauze and walked out. At 2:27 a.m., Officer Harlan returned to the trauma corridor. "My sergeant says backup is short. He is trying to find someone." Natalie looked at him. "That is not an answer." "No, ma'am. Stay alert." He gave a tired smile. "I thought hospitals were supposed to be safer than the street." Natalie looked through the glass at Jonah Vale motionless beneath white sheets and wires. "They are buildings," she said. "People decide whether they are safe." Harlan's smile faded. From the far side of the ER, Tyler called her name. Natalie, the little girl's breathing sounds worse. She turned immediately. The child from the waiting room was awake now, eyes wide, pulling hard for air. Her father stood behind her, helpless and pale. Natalie lowered herself to the child's level. "Hey, sweetheart. I'm Natalie. I'm going to listen to your lungs." The girl clutched her stuffed rabbit and stared. Natalie warmed the stethoscope head in her palm before placing it against the small back. Wheezing. Tight. Retractions. Denise Natalie called calm but carrying. "Bay 1. Neb treatment. Pediatric respiratory." The father's voice shook. "She was fine this morning." Natalie looked at him. "I know. Kids can turn fast. We are moving fast with her." He nodded too many times. The girl began to cry without enough air to make much sound. Natalie took her hand. "Look at me. In through your nose if you can. Slow out, like fogging a window." The child tried. The father watched Natalie as if she had become the only solid thing in the room. For the next 20 minutes, Natalie belonged to that child. Medication, oxygen, reassurance, listening again, watching the shoulders, watching the lips, watching the father watch her. The treatment worked. The girl's breathing eased. Natalie stepped out of Bay 1 and found Tyler waiting with a fresh set of gloves. "How did you know she was worse before the monitor alarmed?" he asked. She stopped fighting the air. "What does that mean? When people struggle, they still have strength. When they get quiet too fast, you pay attention." Tyler absorbed that with a small nod. "You notice everything." Natalie tossed used packaging into the bin. "No. Just enough." The clock over the nurse's station read 3:02 a.m. Denise was on the phone again. Pike was charting with one hand and drinking cold coffee with the other. Officer Harlan stood outside Trauma Bay, 2 sandwich untouched. Now his attention finally sharpened. The waiting room had thinned, but not emptied. Rain silvered the glass doors. Natalie went to the sink and washed her hands. For a moment, under the hot water, she saw another sink. Metal basin, canvas walls, generator light. Her own hands younger and red to the wrists. A soldier on a cot asking if he still had both legs. Colonel Nathan Rourke outside the tent. Voice calm, telling someone that the convoy had to move before dawn, whether medical cleared them or not. She shut off the water. The reflection in the small mirror above the sink looked back at her. Natalie Reed. Not Cross. Not tonight. Then the security monitor flickered. Just once. Natalie turned her head. The camera feed from the ambulance entrance blinked. Gray returned, then blinked again. She walked to the desk. Denise. Denise followed her gaze. Storm. Maybe. The feed stabilized. The hallway behind triage seemed suddenly too quiet. Natalie looked toward Trauma Bay 2. Officer Harlan had turned his head toward the main entrance, listening. The automatic doors opened. 4 men stepped in from the rain. For half a breath, nobody understood what they were seeing. Then the first rifle lifted. Natalie's hand closed around the edge of the counter. The ceiling exploded white. Plaster burst above the waiting room and fell like dirty snow over chairs. Coats, hair, open mouths. For 1 second, Mercy Ridge did not sound like a hospital. It sounded like a place underwater. The shot had swallowed everything. Then the screams came rushing back. The father in Bay 1 folded himself over his little girl. The truck driver dropped from his chair and hit the floor hard, his injured hand leaving red across the tile. The elderly woman with the basin did not move at all. She sat, frozen eyes open as dust settled on her church coat. The man with the rifle swept the room. "Nobody moves," he shouted. "Phones on the floor. Hands where I can see them." 3 others spread out behind him. Natalie Reed stood at the triage desk with one hand still gripping the counter. Her pulse did not leap the way it should have. That scared her more than the gunfire. The body remembers before the mind admits it. The leader was tall, lean, his beard trimmed close, his rifle tucked tight against his shoulder. He did not waste motion. Not a soldier, Natalie thought, but trained by someone who had watched soldiers closely. The second man moved toward the ambulance corridor with a rifle checking corners, too careful to be new. The third stayed near the glass doors, handgun, low eyes flicking to the parking lot. Nervous. The fourth, stocky, thick-neck black cap pulled down, grabbed the truck driver by the back of his jacket and shoved him flat. The fourth man barked at Natalie. On the floor. Natalie looked at him. Not long, not boldly, just enough. He saw scrubs. He saw a tired woman behind a desk. He saw no threat. That was the space he gave her. She placed the alcohol wipe on the counter slowly, like a person trying not to make trouble. Then she lowered herself behind the triage station. The leader shouted toward the hall. "Trauma Bay 2. Now!" Officer Harlan's voice came from the corridor. "Stop right there." Natalie closed her eyes. The rifle cracked once. A body hit the floor. The father in Bay 1 made a sound like he had been punched in the chest. Tyler Boone was behind the nurse's station, face drained white, both hands clamped over his mouth. Natalie did not look at him yet. She counted. 4 attackers. 1 shot fired before entry. 1 officer down. 18 civilians visible. Denise behind the medication counter. Pike somewhere near Bay 3. Jonah Vale in Trauma Bay 2 sedated and breathing through a tube. No police backup. No time. The stocky man was still watching the waiting room. The leader and the second rifle had moved toward the trauma corridor. The nervous one stayed near the doors. Natalie slid sideways behind the triage desk. The lower cabinet blocked her from view. She reached up, felt along the underside of the counter, and pressed the latch to the side access panel. It stuck. It always stuck. She had complained twice. No one had fixed it. She pulled harder. The panel opened with a soft scrape. She slipped through into the narrow supply passage behind triage and closed it with 2 fingers before it could swing. Her breath came once slow. The hallway was dim. One of the overhead lights flickered from the shock of the first gunshot. The air smelled of dust disinfectant and hot wiring. Natalie removed her badge and tucked it into her pocket. No swinging plastic, no flash of white. She listened. Boots on tile, voices low, someone crying in the waiting room. A monitor alarm from trauma, too steady and high. She moved. Not fast. Fast was loud. At the first supply closet, she slipped inside and left the door open 2 inches. Shelves rose around her, stacked with gauze saline flushes, tape restraints, old boxes of gloves. Her hand found the plastic bin on the second shelf. Zip ties. Behavioral restraints had run short the previous week, so Denise had ordered extra ties and hidden them from administration because administration believed violent patients could be managed with policy language. Natalie took 4. The stocky man's footsteps came closer. He was sweeping the corridor alone. That told her the team was confident. Or arrogant. Usually those looked the same until people started bleeding. "Come on out, nurse," he called softly. He was enjoying it. Natalie lowered her center of gravity and placed one palm against the inside of the door. The footsteps stopped outside. The door pushed inward. His handgun entered first. Natalie slammed the door into his wrist. The sound was small and awful, bone against metal. His fingers opened. The gun clattered across the closet floor and spun beneath a shelf. He cursed and lunged forward. Natalie stepped into him instead of away. She drove her shoulder under his chest, hooked one foot behind his ankle, and sent his weight into the shelving. Boxes fell around them. He grabbed for her hair. She turned her head just enough, caught his arm, and folded it across his own throat. He was strong, stronger than her. Strength was not new information. He bucked backward, trying to crush her against the shelves. She let the impact land across her shoulder and shifted her knee into the back of his thigh. His balance broke. She rode him down hard, forearm under his jaw, one knee in the hollow of his back. He clawed at her arm. "Stop fighting," she whispered. He did not. She tightened. Not too long. Long enough. His body kicked once, then went loose. Natalie kept pressure for one more breath, then released and rolled him onto his side. Airway clear, breathing rough but steady. She found his gun under the shelf, checked it with hands that knew the motions, then placed it in the waistband beneath her scrub top. It felt wrong there. Not unfamiliar. Wrong. She zip-tied the man's wrists behind him, then looped a second tie through the shelf support. He would not go far when he woke. Outside, someone screamed in the waiting room. Natalie stepped into the passage and closed the closet door. Tyler was in the linen room. She found him by the sound of his breathing. The door was half shut. He crouched between 2 carts of folded sheets, phone in his shaking hands, screen lit but untouched. Natalie eased the door open. "Tyler!" He flinched so hard his shoulder hit the cart. "It's me." His eyes dropped to the handgun tucked under her scrub top. His face changed. "Natalie," he whispered, "what are you doing?" "What I can. How did you get that from someone who did not need it anymore?" His breathing became ragged. She stepped inside, crouched in front of him, and put her hand on the cart. Not on him. People in shock needed space and an anchor. "Listen to my voice," she said. "You are going to call 911. Tell them 4 armed intruders inside Mercy Ridge. 1 officer down outside Trauma Bay. 2. Multiple civilians in the ER. Possible hostage threat." His thumb hovered over the screen. 1 officer down, he repeated. "Good. Say active threat. Say rifles. Say federal patient if they ask. Federal patient. Just say it if they ask." His eyes filled. "Are we going to die?" Natalie looked at him, not gently, clearly. "Not if people do what they are good at. Right now, you are good at making that call." He nodded, swallowed, and dialed. She closed the door softly and moved on. The main corridor opened ahead near radiology. The second rifleman was there, moving room by room. Older than the others. Gray at the temples. Rifle held correctly. He paused before each doorway and checked with method. Natalie stopped before he saw her. No clean approach. No cover. The handgun at her waist had 7 rounds after the chambered one, but firing in an ER hallway meant bullets through doors, monitors, oxygen lines, human bodies. A gun was not a solution. It was a storm you invited indoors. Her eyes moved. Fire extinguisher mounted beside radiology. Rolling IV pole outside Bay 5. Crash cart 30 feet behind her. She reached the extinguisher first. The metal bracket screamed when she pulled it free. The rifleman turned. Natalie already had the hose up. White CO2 blasted the corridor. The cloud swallowed his face and chest. He jerked back, blinded coughing rifle rising without target. Natalie came through the fog low and fast. She drove the IV pole sideways into his knee. Not pretty. Effective. His leg folded. The rifle fired once into the wall. Tile shattered. She hit him again with the pole across the forearm. The rifle dropped against its sling. He swung blind and caught the side of her jaw with enough force to flash light across her vision. She kept moving. Inside his reach, past the power of the rifle, elbow into ribs, knee into thigh, shoulder into sternum. The body has switches if you know where to press and how much pressure a person can ignore before breath leaves them. He went down against the wall. Natalie followed him, pinned his weapon under her shin, and drove the heel of her palm into the side of his head. Once. Twice. He stopped reaching. She checked his pulse. Alive. Her hands began to shake as she zip-tied him to the base of a wheelchair. She stared at the trembling for half a second. Not now. The words did not stop the shaking. They gave it a place to wait. She took his rifle, cleared the strap from his body, then set it aside under the radiology counter where no patient could reach it. She kept the handgun. Small, close, less visible. A door cracked open behind her. Denise Mallory looked out from the medication room, eyes wide but voice controlled. Natalie, stay in there. Pike is in Bay 3 with 2 patients. He has the door blocked. Good. Was that you, Natalie? Met her eyes. Denise understood enough not to ask the whole question. The waiting room, Natalie asked. Still held. One near the doors. Keep everyone down. If you hear shooting from trauma, do not come out. Denise's mouth tightened. You are bleeding. Natalie looked at her arm. A scrape only. Not the real cut yet. Not enough. She moved before Denise could stop her. Officer Harlan lay outside Trauma Bay 2. He was on his side, one arm bent under him, blood dark in his hair. His service weapon was gone. Natalie dropped to one knee, touched 2 fingers to his neck. Pulse. Strong enough. She lifted one eyelid. Pupils uneven but reactive. Ben, she said softly. He groaned. Do not move. You are hurt. I am turning you. She rolled him into recovery position and pulled him behind a medication cart, using the cart as cover from the trauma bay glass. He tried to speak. Vale. I know. They took my radio. Stay quiet. He gripped her wrist with surprising strength. Evidence bag, he breathed. Locked drawer. Nurse's station. Then his eyes rolled back. Natalie checked him again. Alive. For the moment. Through the glass of Trauma Bay 2, she saw Jonah Vale on the bed, pale under the lights. Ventilator tube. IV lines. Monitors. Blood pressure still low but holding. The leader stood near the foot of the bed, phone pressed to his ear. The third attacker, a broad man with a shaved head, watched the corridor with a rifle angled toward the door. Natalie pulled back before his eyes reached the glass. 2 remaining. 1 patient between them. No cover inside the bay. Too much glass. Too many oxygen lines. Too many ways for one bad round to turn the room into fire and blood. She needed them to move. The old intercom panel was behind the nurse's station under a shelf nobody used. Mercy Ridge still had it because Mercy Ridge never replaced anything that could be ignored. Natalie crouched below the counter, lifted the handset, and pressed Trauma Bay 2. Static crackled. Then voices. "He cannot walk," the third man said. "Then we carry him," the leader snapped. "He is tubed. Pull it. He dies if we pull it." A pause. The leader said, "That may be the point now." Natalie pressed transmit. "No." Silence. The leader's voice came back colder. "Who is this?" Natalie kept her mouth close to the handset. "The nurse you told to get on the floor." Another silence, thinner this time. "You are making a mistake," he said. "You came in with 4. You are down to 2. The third man swore. The leader said, "You are bluffing. The man in the supply closet is breathing through a bruised throat and tied to shelving. The man by radiology is tied to a wheelchair and will need imaging when this is over." She heard movement in Trauma Bay 2, boots shifting, a monitor alarmed when someone brushed Jonah's IV line. Natalie continued. "Your officer is alive. Your target is alive. That gives you choices." The leader laughed once without humor. "You think this is negotiation? No, I think this is math. You do not know the numbers. I know yours just changed." He did not answer right away. She could hear him breathing near the speaker, slow, angry, calculating. Then he said, "Step into the hallway where I can see you, or I put a round through him." Natalie released the transmit button and set the handset down. She had needed time. She had gotten it. She moved away from the nurse's station and took the side corridor past Bay 4. It narrowed near the medication dispenser, then opened toward trauma from an angle that most people forgot existed because it was inconvenient for charting and useless for stretchers. Useful for ambush. The third attacker came out of Trauma Bay 30 seconds later. He moved fast rifle up head, turning toward the intercom first. Wrong direction. Natalie hit him from the side. The first impact drove him into the crash cart. Metal drawers burst open. Syringes and sealed packs scattered across the floor. He was heavier than the others, and he recovered fast. His elbow caught her ribs. The air left her. His hand found her scrub top and slammed her backward into the medication dispenser. Pain went white behind her eyes. He swung the rifle around. She trapped the barrel with both hands and turned it toward the ceiling as he fired. The shot blew out a light panel. Sparks rained. He drove forward using size. She let him. Her back hit the wall. She slid down, pulled his weight over her hip, and sent him stumbling into the cart. He grabbed a broken drawer edge and came back with it in his fist. The metal caught her forearm. This time the cut opened deep. Blood ran hot into her palm. She barely felt it. Natalie stepped inside his next swing and struck his throat with the heel of her hand. Not hard enough to crush. Hard enough to shock. He gagged. She kicked the side of his knee. He dropped. She caught his head and guided it into the rubber bumper of the crash cart with a dull crack. He went still. Natalie stood over him, breathing through her teeth. Blood ran down her fingers and dripped onto the tile. She took 3 seconds to wrap her sleeve tight around the wound. Her hands wanted to shake again. She did not let them vote. She picked up his rifle. The weight settled into her shoulder with a familiarity she hated. Trauma Bay 2 was 15 steps away. Inside, the leader stood with his rifle aimed at Jonah Vale's chest. His phone lay on the floor. He had heard enough. Natalie entered the doorway. He turned the rifle from Jonah to her, then back to Jonah, choosing the easier target. "Put it down," he said. Natalie stopped at the threshold. The room was too bright, the monitors too loud. Jonah's heart rhythm marched across the screen in green lines. Ventilator breath, drip chamber ticking, blood on Natalie's sleeve, blood on the floor from somewhere else. The leader's eyes moved over her, the rifle in her hands, the cut on her arm, the calm he no longer trusted. "You are not a nurse," he said. Natalie kept the rifle low but ready. "Yes, I am. No nurse does this. You have not met enough nurses." His face twisted. "You think you saved anyone? You have no idea what that man is. I know he is breathing. That is temporary. Everything is. His grip tightened. His left hand trembled near the forward rail. Natalie saw it. She let her voice flatten. You are holding too far forward. He blinked. What? Your left hand. You moved it up because it is shaking. It gives you the feeling of control, but it slows your correction if you fire. Shut up. Your feet are wrong too. I said shut up. You have trained for entry and intimidation, not for a room where the person you dismissed is still standing. His jaw worked. For the first time, he looked past her, toward the hall, toward the men who were not coming. His certainty cracked without making a sound. From outside the hospital came the first low thump of rotor blades. Natalie felt it in her sternum before she heard it clearly. The leader heard it too. His eyes flicked to the window. White light swept across the glass. Once. Twice. Then the parking lot filled with hard beams and moving shadows. A radio on the third attacker's vest crackled from the hallway. All units, federal perimeter established around Mercy Ridge Medical Center. All exits covered. Armed suspects inside stand down immediately. The leader's rifle lowered an inch. He caught it and raised it again. Too late. Natalie had seen the inch. That is for you, she said. His mouth opened, but no words came. The ER doors thundered somewhere behind them, not from chaos now, but from practiced entry. Boots moved in pairs, voices low and clipped. Federal tactical teams swept the corridor with a kind of quiet pressure that pushed the air ahead of them. The leader backed toward Jonah's bed. Natalie took one step in. Do not, he warned. Then stop pointing a rifle at my patient. The first federal agent appeared behind Natalie's left shoulder rifle, trained past her. Drop the weapon, the agent ordered. The leader turned his head toward the new voice. Half a second. Natalie crossed the room in 3 strides. She caught the barrel, drove it upward, and slammed her shoulder into his chest. The rifle fired into the ceiling. He hit the wall beside the supply cabinet. Federal agents flooded around her bodies and gear and commands, taking him down under practiced hands. Natalie stepped back. Her rifle lowered. The room kept moving, but inside her something went silent. A medic pushed past to check Jonah. Another agent secured the leader. Someone called for EMS support. Someone else shouted for trauma assessment on Officer Harlan. Natalie looked down at her own hand. It was red to the wrist. For a moment she was not in Mercy Ridge. Canvas walls, generator light, rotor wash, a soldier asking if he was going to die. She blinked and the trauma bay returned. Special Agent Caleb Monroe entered after the tactical team. He was early 40s, compact, dark-skinned, clean-shaven, wearing body armor over a gray shirt. His eyes took in the room, the patient, the blood, the restrained leader, then Natalie. He did not look surprised enough. That was the first thing she noticed. Natalie Reed, he asked. She looked at him. Yes. His gaze dropped to the rifle in her hands. You can give that to me. She handed it over, butt first. His eyes moved to her bleeding arm. You need treatment. There are others ahead of me. He studied her for one more second. Then he said quietly, not quite low enough. Sergeant Cross. The name entered the room like another gunshot. Natalie went still. The monitors kept beeping. Agents kept moving. Jonah Vale kept breathing through the tube. But Natalie heard only the name she had buried. She looked at Monroe, and the blood from her arm fell in slow drops between them. Who told you that, she asked. Special Agent Caleb Monroe did not answer right away. Around them, Mercy Ridge Medical Center tried to become a hospital again. Federal agents moved through the trauma bay with quiet commands. A medic checked Jonah Vale's lines. Another knelt beside the wall where the last attacker had been pinned and cuffed. Somewhere down the corridor, Denise Mallory was calling out names, counting nurses and patients like a woman counting survivors after a flood. Natalie stood in the middle of it, with blood soaking through her sleeve. Monroe watched her face, not the wound. That told her enough. He was not guessing. He knew. "Natalie Reed is your legal name," he said quietly. "I know that. I am not here to challenge it. You used a name no one here knows." "I know." "Then answer me." His eyes moved once toward the open trauma bay door. Too many ears, too much noise, too much equipment still screaming because Jonah Vale's body had not been told the shooting was over. Monroe lowered his voice. "Not here." Natalie laughed once. No humor, just air forced through exhaustion. "You say my old name in the middle of my emergency room and now you want privacy?" "I said it because I needed to know whether you were still functional." Her jaw tightened. "And you are standing." "That is not the same thing." "No," Monroe said. "It is not." For the first time, something like respect entered his voice. Not warmth, not pity. Natalie disliked pity more than pain. Respect she could stand if it stayed honest. He looked at her arm again. "You need stitches. There are patients first. The active threat is contained. That does not make everyone stable." Behind him, Jonah Vale's ventilator gave a soft, mechanical breath. Natalie looked at the man on the bed. Pale face, tape across the tube, dried blood near the collarbone. The center of the whole night, still unconscious, still silent. Monroe followed her gaze. "He is the reason they came." "I figured that part out." "You do not know why." Natalie looked back at him. "No." "But you do." "Yes." A federal medic stepped beside Natalie with a trauma dressing in one hand. "Ma'am, your arm." Natalie held it out without looking away from Monroe. The medic cut the blood-soaked sleeve from wrist to elbow. The wound across her forearm opened under the lights, clean and deep red edges pulled apart where the metal drawer had caught her. The medic pressed gauze over it. Natalie did not flinch. Monroe noticed. Of course he did. Men like Monroe noticed what people tried to hide. "Come with me," he said. 5 minutes. You can keep the dressing on. Then you can go back to being impossible." "Where family consultation room." Natalie glanced down the corridor. Denise stood near the nurse's station with one hand on Tyler Boone's shoulder. Tyler was shaking but upright. Dr. Pike emerged from bay, 3 hair-disordered white coat streaked with someone else's blood, eyes fixed on Natalie as if she had become a patient he did not know how to diagnose. Natalie looked away first. "All right," she said. Monroe led her through the ER. The hallway looked longer than usual. That happened after violence. Buildings stretched, corners deepened, distances became personal. Plaster crunched under her shoes near the waiting room. Federal agents had pushed the civilians into safer pockets, but fear remained in the chairs, in the dropped phones, in the blood smear where the truck driver had crawled away from the first shot. The little girl from Bay 1 was being held by her father. Her breathing was easier now, but her eyes followed Natalie across the room. Natalie did not let herself stop. The family consultation room sat at the end of a short hall most visitors never noticed. It was painted beige because someone had once believed beige made grief softer. There was a box of tissues on a low table, 2 chairs, a couch with a stain no one had managed to remove, and a window that looked onto the ambulance bay. Monroe closed the door. The room became too quiet. Natalie sat because her knees had begun making their own decisions. Monroe remained standing for a moment, then seemed to reconsider the shape of authority and took the chair across from her. "My name is Caleb Monroe. Federal Bureau of Investigation Organized Crime Division temporarily attached to a joint task force operating in West Virginia, Kentucky, and Ohio." Natalie pressed the gauze tighter to her arm. "You have 30 seconds before I leave. Jonah Vale is a protected federal witness. 11 months ago, he began cooperating with us against an organization called the Calder Network." Natalie said nothing. Monroe continued. "The public version is that Calder is a private logistics company with security contracts and offshore freight interests. The real version is money movement, witness intimidation, illegal transport, and enforcement for people who can afford distance between themselves and the crime. The 4 men tonight were Calder. Yes. They came for Jonah. They came for 2 things. Jonah Vale and the encrypted drive Officer Harlan secured before he went down. Natalie's eyes shifted. Ben said evidence bag, locked drawer. He bought us the case when he did that. He almost died for it. He is in surgery prep now. Head injury, but he has a pulse and a fighting chance. Natalie let the words settle. A pulse and a fighting chance. In medicine, that was sometimes a blessing and sometimes a cruel way to delay grief. What is on the drive? She asked. Calder routes, payment records, client identities, internal placement notes, and files that connect Calder to former military personnel. The air in the room changed again. Natalie felt it touch the back of her neck. Monroe watched her see the shape before he named it. One of those names is Colonel Nathan Rourke. Her hand stopped pressing the gauze. The pain arrived then, sudden and bright, as if the wound had been waiting for permission. Monroe leaned forward slightly. You knew him. He commanded a unit I was attached to. That unit does not exist in public records. Then you already know the right answer. I know a version. I need yours. Natalie looked at the window. Outside, the ambulance bay lights painted the wet pavement red, then white, then red again. The rhythm made the glass look alive. Nathan Rourke gave orders, she said. People followed them. That was the work. That is not all it was. Her eyes returned to him. No, it was not. The door opened before Monroe could speak. A woman stepped in wearing a dark field jacket over civilian clothes, hair cut to her jaw posture, straight enough to give away the uniform even without insignia. Her face was calm, but her eyes carried the sleepless sharpness of someone who had arrived already briefed and still unhappy with what she had learned. Monroe stood. Major Quinn. Tessa is fine in this room, she said. Natalie studied her. Military legal. Maybe Judge Advocate General. Maybe something adjacent. The kind of officer who knew how to speak in clean lines because messy words became evidence. Tessa Quinn closed the door behind her. Natalie Reed. Natalie did not answer. Tessa corrected herself. Sergeant First Class Natalie Cross, formerly attached to Forward Surgical Response Element 6. Natalie's voice went cold. Do not use the full designation. Tessa paused, not offended. Adjusting. Understood. Monroe glanced between them. Tessa sat slowly, leaving space, no sudden movements. Natalie noticed that too. People who knew trauma either learned to respect distance or enjoyed violating it. Tessa respected it. I reviewed parts of your sealed medical reports, Tessa said. Natalie's mouth tightened. They were sealed. They still are, technically. That word is doing too much work. I agree. Monroe folded his arms. Tessa looked at Natalie direct and unadorned. Jonah Vale has documentation showing that Colonel Rourke used Calder contacts to suppress records from 3 operations during your 2nd deployment. Your reports were part of those records. Natalie looked down at the blood darkening the gauze. In her mind, another room opened. Canvas walls, sand against her teeth, a generator coughing in the dark. A young corporal named Avery lying on a cot, eyes wide, both hands gripping Natalie's wrist while she tried to keep pressure on a wound that kept pushing blood through her fingers. Outside, Rourke's voice, calm over radio static. Move the convoy. Inside, Natalie saying he is not stable. Outside, Rourke saying move the convoy. The memory snapped shut. What did Jonah find, she asked. Tessa's answer came carefully. Payments, messages, altered after action summaries. Medical evacuation timelines changed after submission. Casualty classifications revised above your clearance level. Your original notes survived in a backup archive. Natalie's throat felt dry. I wrote what I saw. Yes. I did not know what they changed. We believe that. Belief is not protection. No, Tessa said. Evidence is. Monroe stepped in. Rourke has spent years building protection around those operations. Calder helped him. In exchange, Rourke connected them with people who needed off-record muscle and clean paperwork. Jonah Vale became useful because he managed placement and movement. He knew where names were buried. Why cooperate now? Because Calder tried to remove one of his own couriers and killed the wrong person in front of him, Monroe said. Jonah decided he could survive as a witness or die as an employee. Natalie absorbed that. People did not become brave all at once. Usually they became trapped, then ashamed, then too tired to keep lying. The men tonight knew Jonah was here. Yes, they knew the layout. Monroe's expression hardened. Yes, they knew the night shift was thin. No one answered fast enough. Natalie leaned back slow. There is someone inside Mercy Ridge. Tessa looked at Monroe. Monroe did not deny it. We suspected a local facilitator, he said. We did not have the hospital connection confirmed before tonight. Natalie thought of Martin Keene in his dark overcoat phone turned face down, eyes moving past her into Trauma Bay 2. You should look at Martin Keene. Monroe's gaze sharpened. Operations director. Yes. Why he was here at 2 a.m. before the attack. He asked about my prior military service. Tessa sat forward. Those exact words. He said I listed prior military service in my hiring file, then called it curiosity. Monroe took out his phone and typed a message with fast thumbs. Natalie continued. He has been cutting overnight staff for months. Not evenly, strategically. Senior nurses first, people who notice patterns, people who challenge discharge decisions. He calls it efficiency. Tessa said, could be ordinary hospital rot. It could, but you do not think so. Natalie looked at her. Ordinary rot smells different. For a brief second, Tessa almost smiled. Monroe's phone vibrated. He read the message and whatever he saw closed his face. What Natalie asked. Keene left the building 12 minutes ago. Natalie stood, too quickly. The room tilted. She caught the edge of the table with her good hand. Monroe rose with her. Sit down. He left during the federal sweep. He used the administrative exit. Then he was never trapped here. We have teams moving. Natalie looked toward the door. He knows you are here. He knows Jonah survived. He knows the drive is gone. Monroe nodded once. And if he is connected to Calder, he is calling someone right now. The words had barely left his mouth when Natalie's phone buzzed in her scrub pocket. All three of them looked at it. The sound was small, ordinary, almost obscene. Natalie pulled it out. Unknown number. Monroe held out a hand, palm down. Do not answer yet. The phone buzzed again. Tessa stood moving toward the corner of the room where her own signal recorder was clipped to her belt. Monroe spoke quietly. Put it on speaker. Say as little as possible. Natalie pressed accept. No one breathed. A male voice came through older controlled, polished smooth by money and rehearsal. Ms. Reed. Natalie said nothing. My name is Grant Hollis. I represent a client with an interest in the unfortunate events at Mercy Ridge this morning. Monroe's eyes locked on hers. Natalie kept her voice flat. What client? I am not authorized to disclose that immediately. Then we are done. Colonel Nathan Rourke, the voice said. The room held still. The man continued. Colonel Rourke believes there has been a misunderstanding, and he would like an opportunity to speak with you privately before federal personnel create a narrative that damages everyone involved. Natalie looked at Monroe. His face had gone hard in a way she had not seen yet. "Why would Colonel Rourke want to speak with a nurse?" she asked. A pause. Too long. "Because he respects your service." There it was. Not the answer. The trapdoor beneath it. Natalie's voice did not change. "My service. Yes, Ms. Reed. Ms. Reed. Not Cross. Not Sergeant. Not the sealed name. Reed." Monroe heard it at the same time she did. His eyes shifted once toward Tessa. Tessa's hand closed around the back of a chair. Natalie let the silence stretch. The caller filled it. "My client believes matters can be resolved quietly. He is prepared to meet this afternoon. Neutral location. No press. No lawyers beyond myself unless you request representation. I need time." "Of course. Do not call this number again until I decide whether to answer." "That is acceptable." The call ended. Natalie lowered the phone. No one spoke for several seconds. Then Monroe said, "He called you Reed?" "Yes." "Not Cross?" "Yes." Tessa's face was pale beneath the control. "That means Rourke got your current identity from someone outside the sealed military channel. Or from someone inside this hospital," Natalie said. Monroe was already dialing. "Access logs. Administrative exit, visitor registry. Pull everything for Keene, last 18 months. I want badge entries, camera captures, phone metadata if legal can clear it, and anyone who met him after 10 p.m. He listened for 3 seconds. Then, wake legal. He hung up. Natalie sat again, but not because he told her to. Her body had begun to spend the adrenaline and the bill was coming due. Her arm throbbed, her jaw ached. Her ribs hurt when she inhaled. Every sound from the ER pushed through the closed door and landed under her skin. Tessa moved closer. "I can dress that properly." Natalie almost refused. Then she held out her arm. Tessa worked with a field kit from her bag, cleaning blood from the wound with hands that were competent but not clinical. Military competent. Efficient, unsentimental, careful when care mattered. "You were a medic?" Natalie asked. "No." "My brother was." "Was?" Tessa's hand paused for half a beat. "Afghanistan. Different unit. Different war on paper." Natalie looked at her face and understood that no war was different enough for the people who waited for the knock. Tessa placed a sterile strip across the wound. "Your reports may help families get answers." Natalie stared at the beige wall. "That is a heavy thing to put in a room." "I know." "No," Natalie said. "You know the legal weight. Not the rest." Tessa accepted that without argument. From the hallway came Denise's voice, sharp and close. "I do not care what badge you have. If you block my medication room again, I will move you myself." Monroe opened the door. Denise stood outside with Tyler behind her. Tyler's eyes were red. Denise took one look at Natalie's bandaged arm, Monroe, Tessa, and the closed room. Her expression shifted from anger to calculation. "Natalie," Denise said, "Pike needs you." Monroe frowned. "She is not cleared for duty." Denise gave him a look that could have stopped a drill sergeant. "I did not ask if she was cleared. I said Pike needs her." Natalie stood. "What happened? Jonah Vale's pressure is dropping again. Pike says it may be sedation. I think he is lying to himself because vascular is still 20 minutes out." The hospital sounds sharpened through the open door. A monitor alarm rose from trauma bay, too fast and ugly. Natalie pushed past Monroe before anyone could stop her. The corridor lights seemed too bright now. Federal agents turned as she moved through them. Dr. Pike stood inside trauma bay, one hand on Jonah's abdomen, eyes fixed on the monitor. He looked up when Natalie entered. For the first time since she had known him, he did not look annoyed to see her. He looked relieved. "Reed," he said, "tell me what you see." Natalie stepped to the bedside. Jonah Vale's skin had gone wax gray. His pulse fluttered at the neck. The blood pressure cycled again and dropped lower. She placed her good hand on his abdomen, felt the tension beneath the skin, the wrong fullness building where it should not. Her voice came out quiet. "He is bleeding," Natalie said. The words did not hit the room loudly, but they changed everything. Dr. Samuel Pike looked down at Jonah Vale's abdomen, then at the monitor, then at Natalie's hand resting over the rigid swell beneath the sheet. His face did not argue. That was new. How sure, he asked. Sure enough to stop wasting time. The blood pressure cuff cycled again. 68/36. Jonah's heart rate climbed fast and thin, the rhythm starting to stumble as his body tried to outrun what it was losing. Pike turned toward the door. "Denise, call vascular again. Tell them he is unstable and I need an operating room now." Denise was already moving. "Already called. I am calling louder." Tyler stood just outside the trauma bay, holding a stack of fresh towels he did not remember picking up. His eyes moved from Jonah to Natalie to the blood soaking through the new dressing on her arm. Natalie saw him and pointed with 2 fingers. "Tyler. Crash cart. Blood cooler. Move." He blinked. Then the command gave his fear somewhere to go. "Yes. Yes, I've got it." He ran. Pike stripped the sheet back. Jonah Vale's abdomen was tight, the skin pale and stretched around the old surgical dressing from the first hospital. Not a dramatic bleed. Not a river on the floor. Worse in some ways. The kind that hid inside the body until the body could not hide it anymore. Natalie checked the line, then the drainage, then the color of Jonah's skin around the mouth. "He held for too long," she said. Pike looked up. "What?" "The repair. Whatever they did before he got here, it held just long enough to make everyone believe it would keep holding." Pike's jaw tightened. Torres he called to the day nurse at the medication cabinet. 2 units unmatched. Now. Torres looked at Natalie once. There was uncertainty there, but not resentment. People in hospitals learned quickly who had useful fear and who only had noise. On it. Agent Monroe stood in the doorway, body angled like he wanted to enter but knew enough not to contaminate the room. "Can he be moved?" he asked. Pike did not look at him. "If he does not move, he dies here." Monroe stepped back. Natalie leaned close to Jonah's ear as if he could hear her beneath the sedation, beneath the blood loss, beneath the machines. "Stay with us, Mr. Vale. You did not survive all night just to quit in my trauma bay." The monitor answered with another alarm. The next 3 minutes compressed into hands. Torres hung blood. Denise cleared the hallway. Tyler returned with the crash cart and nearly clipped the door frame, then corrected himself before anyone had to yell. Pike gave orders shorter, now cleaner. Natalie anticipated the ones he had not spoken. Pressure bag, suction, transport monitor, extra gauze, manual airway backup. She moved with one bad arm and the rest of her body compensating without permission. Each step hurt. Her ribs reminded her of the third attacker. Her jaw pulsed where the rifleman had struck her. Her forearm burned under the dressing. None of it had priority. Jonah did. They rolled him out of trauma bay 2 with Pike at the head. Natalie on the right side near the lines, Torres at the left, and Tyler clearing the path with a look on his face that said he had never understood how long a hospital hallway could become. Federal agents flattened against walls as the bed passed. One of them reached to help. Natalie snapped, "Do not touch the line." The agent froze. Monroe said, "Hands off unless they ask." They passed Officer Harlan's empty spot near the medication cart. The blood on the tile had been wiped but not erased. Natalie saw the faint stain and kept moving. The elevator doors opened too slowly. Denise hit the button again as if force could shame machinery into obedience. "Come on," she muttered. Pike looked at the monitor. "He is dropping." Natalie lifted the blood bag higher with her good hand. Not fast enough to lose him in the elevator. "You sure know?" The doors opened. They pushed in. For 12 seconds, all of them were trapped in a metal box with a dying man, 2 blood bags, 1 ventilator tube, and the sound of the elevator rising. Tyler stared at the floor numbers. Natalie watched Jonah's chest rise and fall. Pike watched Natalie. She felt it, but did not look at him. The doors opened onto surgery. The operating area was brighter, colder, cleaner than the ER. It smelled like antiseptic, without the old coffee and fear underneath. People in caps and masks turned as Jonah came through. A vascular surgeon named Dr. Amelia Voss, still tying her gown, met them at the door. "I was told unstable abdominal bleed," Voss said. Pike answered gunshot repair from outside facility. Pressure failing, abdomen rigid. "He is crashing." Dr. Voss looked at Natalie. "You called it," Natalie said, from the doorway. Dr. Voss did not ask why a night nurse with a bandaged arm was standing beside the patient. She only looked at the monitor, then at the blood, then at Jonah. "Good catch. Move him." In the operating room, everything became narrower. The world reduced to a table, a body, a wound, numbers, hands, voices. Natalie should have stepped back. She was injured. She had been on shift all night. She had been in a shooting. She had given a statement to federal agents with blood still on her clothes. By any proper rule, she belonged in a chair with someone checking her pupils and asking whether she felt safe. Instead, Pike looked across the operating table. Reed. She met his eyes above his mask. Scrub. No apology, no explanation. Not yet. Just need. Natalie turned to the sink. Hot water hit her hands. Pink diluted into the basin from blood under her nails. The soap smelled sharp and surgical. She scrubbed around the bandage on her forearm and felt the sting bite deep enough to clear the fog gathering behind her eyes. For 1 second, the water became desert water from a hanging bag. The sink became a metal basin balanced on a crate. The overhead light became generator glare. Someone was shouting for plasma they did not have. She pressed her palm flat to the sink. Mercy Ridge, she told herself. Ravenport. Jonah Vale. Not there. Here. She scrubbed in. The surgery took 2 hours and 14 minutes. It felt like 7 minutes and 3 years. Jonah's previous repair had failed at the edge of the damaged vessel. Not fully. Not cleanly. A small leak at first, then a slow internal bleed that became a collapse when his pressure finally gave up compensation. His abdomen had filled quietly, while everyone outside the body believed the crisis was contained. Dr. Voss worked with calm speed. Pike assisted, precise and stripped of arrogance by the simplicity of blood loss. Natalie stood where she was needed, handing instruments, tracking vitals, calling changes before the anesthesiologist voiced them. "Systolic is coming down." "I see it," Pike said. "Not on the cuff, on the skin." The anesthesiologist looked up, then checked the arterial line. "Pressure is falling." Pike's eyes flicked to Natalie, then back to the field. No one questioned her again. Suction hissed. Clamps clicked. A nurse counted sponges in a steady voice. Jonah's body fought, then surrendered, then fought again. Natalie watched the rhythm of the room, the way she had once watched dust lifting beyond a convoy road, noticing what changed before it became visible to everyone else. A shift in hand pressure, a hesitation before a clamp, the slight tightening in Dr. Voss's shoulders when bleeding obscured the field, Pike's breathing becoming quieter as the repair came together. At one point, Jonah's pressure dropped so sharply that the anesthesiologist cursed under his breath. Natalie leaned closer. "He is not empty. He is clamping down." Dr. Voss said, "Explain. Peripheral shutdown. He has reserve if we get ahead of it." Pike looked at the anesthesiologist. "Push blood. Warm him. Now." They did. Jonah came back by inches. No miracle, just work. When the final repair held and the bleeding slowed to nothing more than what the body could forgive, the room did not celebrate. Operating rooms rarely did. They exhaled by degrees. Dr. Voss stepped back. He is stable enough for recovery. Stable enough. In medicine, those two words could carry a person across a canyon. Pike removed his glove slowly. Natalie looked at Jonah's face. Still sedated. Still pale. Still alive. You need to talk, she said under her breath. No one heard her except maybe herself. At the scrub sink afterward, Pike stood beside her without speaking. Water ran between them. Pink at first, then clear. For a while, the silence did its own work. Pike turned off his faucet. You saw it from the doorway. Natalie rinsed her hands. Yes, not guessed. No. He waited. Natalie dried her hands with a sterile towel, careful around the dressing that had started bleeding again beneath the waterproof cover. Internal pressure has a pattern, she said. People think the machines tell the story first. They do not. The body does. The machines translate after. Pike looked at her. Where did you learn that? She could have lied. She could have said trauma nursing. She could have said experience. Both would have been true enough for a hallway. But not for this room. In the field, she said. Pike did not move. What field? The kind where the surgeon is 10 minutes away and the patient has 5. The words landed quietly. Pike looked older than he had before the surgery. Not weaker, just less protected by his own certainty. I have worked beside you for almost 4 years, he said. Yes. And I did not know. You did not ask. His mouth tightened, but he accepted the hit because it was clean. I owe you an apology. Probably. I mean it. I know. He looked at her bandaged arm. You should be in a bed. So should half the county. Natalie. She turned then. He had never said her first name like that. Not as a correction, not as a command. As if he had finally realized there was a person attached to the competence. She softened only enough to keep the words from cutting too deep. Put the apology somewhere useful. Jonah needs a clean handoff, full documentation, and no vague language in the chart. If he bleeds again, recovery needs to know exactly what happened and when. Pike nodded once. I can do that. Good. He left first. Natalie stayed at the sink, hands braced on the edge. The shaking came then. Not dramatic. No collapse. Just a fine tremor through her fingers up her forearms into her shoulders. Her body had waited until Jonah Vale was stable, then it began submitting its complaints. Pain. Exhaustion. Blood loss. No sleep. Gunfire. Old name spoken aloud. Rourke. She closed her eyes. 3 breaths. Then 2. Then 1. The door opened behind her. Reed. Agent Monroe stood in the corridor outside the scrub area. He had removed his helmet, but not the body armor. Without the tactical gear covering his face, he looked more tired, more human, more dangerous in a different way. How is Vale? He asked. Alive. Stable enough for recovery. He may be able to speak tonight, possibly tomorrow, depending on anesthesia and blood loss. Monroe nodded. That matters, I assumed. His expression did not change, but something behind it was moving too quickly. Natalie stepped closer. What happened? Monroe glanced down the hall, then lowered his voice. We picked up Martin Keene. Natalie felt the air leave the space between her ribs. Where Route 19 east of Ravenport. State police stopped him before he reached the interstate. Was he alone? No. She already knew before he said it. Drew Fallon was in the car with him, Monroe said. Known Calder placement contact. Keene had cash, 2 phones, a passport card, and a packed bag in the trunk. He was running. Yes. Not forced. No sign of coercion. He got into the car willingly. Parking lot footage shows him taking a call, leaving through the administrative exit and walking straight to Fallon's vehicle. Natalie looked down the corridor toward recovery, where Jonah Vale was being wheeled somewhere between silence and testimony. Then Keene knew the operation failed. He knew enough to move, which means someone told him. Monroe's jaw tightened. Or he told someone first. Natalie understood the distinction. It made the hallway colder. What did you find in his office? Search is ongoing, but initial sweep found a separate access terminal not connected to hospital inventory, hidden under a false panel inside a locked supply cabinet. In operations? Yes. Natalie almost laughed. A hidden terminal inside a hospital cabinet. Administration really does have better storage than nursing. Monroe gave her a brief look. It almost became a smile and died before it could. We also found printed staffing projections marked by date and trauma designation. Several nights circled. Each corresponds to either a Calder-associated admission or a transfer that got rerouted through Mercy Ridge. So he was shaping the floor. Yes. Reducing coverage. Moving experienced staff off certain windows. Flagging who was on duty. Controlling camera maintenance requests. Natalie thought of the security monitor flickering at 3:02 a.m. He killed the ambulance entrance feed. We believe so. He nearly got everyone in that waiting room killed. Monroe did not soften the answer. Yes. Natalie looked at him, and Rourke Monroe's face hardened in a way that made the answer arrive before the words. Private charter landed at Ravenport Municipal 40 minutes ago. Natalie's hand went still against her side. He is here. Yes. The hospital corridor seemed suddenly full of invisible lines. Roads, exits, angles, distances. Ravenport Municipal to Mercy Ridge. Mercy Ridge to the industrial corridor. Keene's office to the ambulance bay. Rourke's voice crossing years as if no time had passed at all. He knows Keene was caught, she said. We are operating on that assumption. He knows Jonah survived surgery. Not unless he has eyes inside recovery. Do not assume he does not. We are not. She looked at Monroe carefully. You are waiting for something. Monroe held her gaze. He called once through an intermediary. He used Reed. Now that Keene is in custody, he loses that channel. He needs to act before Jonah wakes up enough to testify and before Keene starts bargaining. So, he contacts me directly. Yes. How soon? Monroe did not answer. Natalie's phone rang. The sound cut through the hallway with almost comic timing, small and bright and ordinary. Unknown number. Monroe looked at the phone. Tessa Quinn came around the corner at a fast walk civilian blazer over a dark shirt, eyes already on Natalie's hand. Is that him? Natalie stared at the screen. No one else has this kind of timing. Monroe lifted one finger toward his earpiece and spoke softly to someone on comms. Recording. Now. Tessa stepped closer to Natalie. Speaker. Natalie answered. For half a second there was only faint static and the distant breath of a man who did not hurry because hurry belonged to people with less power. Then he spoke. Sergeant Cross. Nathan Rourke's voice had not changed enough. Older, yes, rougher at the edges, but the cadence was the same. Calm authority wrapped around command. A voice trained to make other voices stop. Natalie did not speak. I think we are past the point where your federal friends pretend they are not listening, Rourke said. So let us save time. Monroe's eyes fixed on hers. Tessa's jaw tightened. Natalie looked through the corridor window toward the gray morning over Ravenport. My name is Reed. A pause. Then Rourke gave a quiet sound that was not quite a laugh. Names are administrative conveniences. You and I both know what you are. And what is that Useful. Still, apparently. Her hand tightened around the phone. Rourke continued. I am going to give you an address. You are going to come alone. We are going to discuss what happens to the records attached to your service, the witness in your hospital, and the people who seem to have placed themselves near you. You mean the people you threatened? I mean the people you have put at risk by refusing to understand the scale of this. Natalie felt Monroe move slightly beside her, a warning without touch. Rourke recited the address. She knew it before he finished. A medical supply warehouse on the eastern industrial edge of Ravenport. 3 blocks from Mercy Ridge, close enough to see the hospital roof from the upper windows. He had chosen it deliberately. Not a hotel, not an office, not a public place. A warehouse tied to medicine close to her work inside the geography of the life she had tried to build. Rourke said, 1 hour. Natalie said nothing. Come alone, Sergeant. Her voice stayed level. You keep saying that like rank gives you ownership. This time the pause was colder. Do not test how little I have to lose. The call ended. For a moment, no one in the corridor spoke. A monitor beeped behind a closed recovery door. A housekeeping cart squeaked somewhere far away. Overhead, the hospital lights hummed with stubborn indifference. Monroe lowered his hand from his earpiece. We got it. Tessa looked at Natalie. He is trying to pull you into terrain he controls. Yes. You are not going. Natalie looked at her. Tessa corrected herself, more careful. You should not go, Monroe said. We have Keene, Fallon, the drive, Vale alive, Rourke on a recorded threat. That may be enough. Maybe, Natalie said. It is a strong case. Strong cases can be weakened. Monroe's face remained still. Natalie continued. Documents get challenged. Witnesses get painted as criminals. Keene becomes a frightened administrator manipulated by Calder. Fallon becomes a logistics man who never knew the full picture. Jonah becomes a cooperating criminal trying to save himself. My reports become battlefield confusion. Rourke becomes a decorated officer with bad enemies and good lawyers. Tessa said quietly. You have thought about this. I have watched men like him survive truth by making truth look complicated. Monroe did not argue. That was how she knew he agreed. He wants me in that room, Natalie said. Not because he thinks I am harmless, because he thinks some part of me still obeys him. Tessa's eyes softened just a fraction. Does it? Natalie looked toward recovery again. She thought of Jonah Vale's open abdomen, the blood under the lights, the repair holding because 3 people refused to let him die. She thought of Officer Harlan securing the evidence bag before losing consciousness. Tyler making the call with shaking hands. Denise counting staff. Pike saying scrub because need had finally cut through pride. Then she thought of Rourke outside a field tent years ago telling them to move the convoy. No, Natalie said. But he needs to say it out loud. Monroe was quiet for 3 seconds. Then his posture changed. Not agreement exactly. Decision. If we do this, we do it my way. Natalie looked at him. Full perimeter. Audio and visual if we can get it. You wear a wire. You do not enter beyond the first clear space unless my team has eyes. You do not accept anything from him. You do not drink anything. You do not let anyone pat you down without us seeing hands. If signal drops, we breach. What is the window? 10 minutes maximum inside. Less if I do not like what I hear. I need a code phrase. You choose. Natalie did not hesitate long. 17. Monroe studied her. Why? It is a number I can say if I need to. It is not likely to come up by accident. Tessa looked at Natalie as if she understood there was more, but she did not ask. Monroe nodded. If you say 17 in any context, we move. Natalie slipped the phone into her pocket. My car. No, Monroe said. Yes. If I arrive in a federal vehicle he knows before I open the door. He may already know. Then do not help him confirm it. Monroe looked like he hated that she was right. Tessa stepped closer. You are injured. Yes. You have not slept. No. You were in an active shooting, then surgery, then interrogation, and now you want to walk into a warehouse with the man who has been hiding behind your records for years. Natalie held her gaze. I do not want to. The honesty settled harder than defiance. Tessa's expression changed. Natalie continued. I am afraid. I have been afraid since he gave the address. That fear is giving me information. He chose a place near the hospital because he wants me to feel surrounded by my own life. He wants me to believe nothing here belongs to me unless he permits it. She looked toward the exit sign at the end of the corridor. He is wrong. No one spoke for a moment. Then Monroe said, We wire you now. They used a small adhesive transmitter no larger than a coin, no movie harness, no dramatic taping across the ribs. Just a flat disc placed beneath the edge of the bandage on her injured forearm, where any search would hesitate to press too hard. The tech agent who applied it was young, focused, and careful not to look at her like a legend or a liability. Say something, he said. Natalie looked at Monroe. Mercy Ridge coffee tastes like burnt regret. The agent checked his receiver. Signal clear. Denise appeared at the end of the corridor as Natalie pulled her sleeve down. Her face took in the agents, Tessa Monroe, the wire team, and Natalie's jacket in her hand. No, Denise said. Natalie turned. Denise walked closer, voice low enough that only the group could hear. No. Whatever this is, no. Natalie did not insult her by pretending not to understand. I have to go. Those are the 4 worst words in any hospital. I know. Denise's eyes shone angry and wet. You already saved the ER. Jonah is alive. That is not the same as safe. Let the federal people be federal people. Monroe said nothing which Natalie respected. Denise stepped closer. You spent years making yourself small enough that no one would ask what you carried. I saw that. I let you have it because sometimes privacy is the last clean thing a person owns. But do not confuse walking back into fire with earning the right to live. Natalie felt the words hit deeper than she wanted. I am not trying to earn anything. Then come back. The command was simple, not heroic. Come back. Natalie nodded once. I will. Denise held her gaze long enough to make the promise real, then stepped aside. Tyler stood behind her, pale and silent. Natalie looked at him. You did good tonight. His mouth trembled. You did not die because I called. No, she said. People lived because you called. He nodded too hard and looked away. Natalie walked toward the side exit with Monroe, Tessa, and 2 plainclothes agents moving at a distance that pretended not to be escort. Outside, the morning had turned the rain into mist. Ravenport lay gray and wet under low clouds. Federal vehicles filled the side lot. Beyond them, the hills rose dark and watchful. Natalie paused beside her old blue Civic. For 4 years, this car had carried her between the hospital and a 1-bedroom apartment with cheap blinds and a kitchen table she rarely used. It had held grocery bags, spare Scrub's gas station coffee, and silence. Ordinary things, chosen things. Monroe stopped near the rear bumper. Last chance to say no. Natalie opened the driver's door. That was never the problem. She got in, started the engine, and listened to it catch. The radio was off. Her hands settled on the wheel. For the first time all night, they were steady again. The engine caught on the second turn. Natalie sat behind the wheel of the old blue Civic and listened to it idle in the mist outside Mercy Ridge Medical Center. Her hands rested at 10 and 2. The hospital lights glowed behind her through the wet morning pale squares stacked against gray brick. Each window holding someone's fear, someone's pain, someone's ordinary life interrupted. For 4 years, this car had carried her away from that building after long shifts. It had carried her home when she was too tired to remember the drive. It had held grocery receipts, spare scrubs, winter gloves, and a tire gauge she never used. It was part of the life she had built because quiet things mattered. Cheap coffee mattered. A clean apartment mattered. Knowing which hallway light in her building flickered mattered. Now, Colonel Nathan Rourke had reached into that quiet life and chosen a place 3 blocks from the hospital to remind her he could touch it. Natalie pulled away from the curb. No federal car followed close enough to see in her mirrors, but she knew they were there. Monroe's team would already be moving through side streets loading docks alleys, roof access points, plainclothes agents, tactical units staged out of sight. Tessa Quinn, somewhere in the pattern angry and precise, making sure the law did not get lost in the hunger to end this. The transmitter under Natalie's bandage warmed against her skin. Her forearm throbbed with every turn of the wheel. She drove east through Ravenport. The city had woken into a wet, colorless morning. Delivery trucks backed into bakery alleys. A woman in a red coat hurried across a crosswalk with one hand over her hair. A school bus hissed at a corner yellow lights blinking against the rain. People moved through their day with no idea that a man who had buried deaths inside classified paper was sitting in a warehouse waiting for the woman who had written the medical truth he could not erase. At a red light, Natalie looked at her reflection in the windshield. Natalie Reed looked back, not untouched, not small, not clean. Blood had dried along the edge of her collar. Her face was pale beneath the bruising near her jaw. Her eyes were too steady the way they became when the body had chosen function over feeling. The light changed. She kept driving. The medical supply warehouse stood at the edge of the industrial corridor where Ravenport's old manufacturing bones still showed through the skin of new business signs. 3 stories of dark brick. Frosted windows. A loading dock with cracked rubber bumpers. A faded sign on the side read, Appalachian Clinical Supply. The parking lot was mostly empty. Natalie did not pull in. She parked on the street facing west with Mercy Ridge's roofline just visible beyond a row of storage units. Old habit. Keep the exit in front of you if you can. Behind you if you must. Never give it away without noticing. Rain tapped the windshield. She shut off the engine. For 10 seconds, she sat still and let the fear speak. It said Rourke had men inside. Likely. It said the warehouse had too many shadows. True. It said she was injured tired and walking toward a commander whose voice still knew how to find old obedience in the spine. True enough. It said, turn around. That one she ignored. Natalie stepped out of the car. A man waited by the side entrance. Plain clothes, dark jacket, shaved head. The jacket hung a little heavy on his right side. Armed. He watched her approach without expression. Phone, he said. Natalie held it out. He placed it in a small signal bag without checking the screen. Professional. Either he had been told not to pat her down or Rourke wanted the wire known and tolerated. The man looked at the bandage beneath her sleeve. You injured, yes. Bad not for you. His eyes flicked to hers. He opened the door. Inside the warehouse smelled of cardboard dust, rubber, and sterile packaging. Industrial lights hummed overhead. Rows of metal shelving ran into shadow stacked with boxed gloves, tubing IV kits. Surgical drapes, plastic bins, and sealed crates marked with hospital inventory codes. Medicine, waiting to be useful. In the center of the open floor, someone had set up a folding table and 2 chairs. Nathan Rourke stood beside the table. He was 62 now, but age had not softened him. It had refined him into harder lines. Silver hair cut close, dark coat, shoulders still squared by decades of command. His face carried the calm of a man who had spent his life speaking last in rooms where others feared speaking first. He looked at Natalie as if she were a report he had expected to remain sealed. Sergeant Cross, he said. Natalie stopped 10 feet from the table. "Read." Rourke smiled faintly. "You always were stubborn about details. Names are not details. They are when history is longer than paperwork." His voice did not rise. It did not need to. The warehouse gave it room. Every word traveled cleanly through the concrete space. Natalie kept her hands visible at her sides. "You asked for a conversation. I asked for you to come alone. You knew I would not." "Yes. Then why ask? To see whether you still felt the need to pretend." Behind Rourke, a second man stood near the far aisle, half hidden by stacked cartons. Natalie marked him without turning her head. The guard at the door remained behind her. 2 visible, maybe more. Rourke gestured toward the chair. "Sit." "No." A small pause. Not surprise. Irritation disciplined into stillness. Rourke sat instead, slowly performing ease. "Very well." Natalie remained standing. He folded his hands on the table. "I watched the footage from Mercy Ridge, from Keene." His eyes cooled slightly. "Martin Keene is a small man who convinced himself access was the same as intelligence. He helped send armed men into an emergency room. He made poor choices. He made your choices." Rourke leaned back. "You have grown more direct. I always was. You just outranked me." The guard by the door shifted. Rourke lifted one finger without looking at him. The guard went still. Natalie noticed. Rourke noticed that she noticed. "I did respect you," he said. The words came softly enough to sound almost honest. Natalie said nothing. "You were one of the finest medics I ever saw. Under fire, under exhaustion, under impossible conditions. Men lived because you refused to accept what the battlefield had already decided. Some did." Rourke's face did not change. "No one saves everyone." "No. But some people kill more than they have to." The warehouse silence tightened. Rourke studied her for a long moment. "I did not bring you here to trade accusations. You brought me here because Jonah Vale survived. You brought yourself here because some part of you still believes this can be controlled by courage." Natalie let that pass through her without taking root. "What do you want?" Rourke placed a folder on the table. It was thin. Too thin for everything it carried. "Clarity." Natalie looked at the folder but did not move. He opened it. Inside were copies of medical reports. Her reports, old formatting, military headers, names redacted in black blocks, times, vital signs, treatment notes, evacuation requests, phrases she had written under generator light with shaking hands she had forced steady. Patient unstable for transport. Evacuation delay increases mortality risk. Command advised. Transport initiated despite medical recommendation. Her own words looked back at her from another life. Rourke turned one page with 2 fingers. "These notes are being interpreted without context." They have context. They have fragments. They have times, injuries, decisions, and signatures. War is not a clinic, Sergeant. Natalie stepped closer to the table. "Do not explain war to the medic who cleaned up after your decisions." The second guard in the aisle shifted his weight. Rourke's mouth hardened. "You were not read into the tactical picture." "No. Then you cannot testify to command intent. I can testify to what happened to bodies after command acted." He looked at her, then really looked, and for a moment the polished officer disappeared. Something older came through. Anger. Yes. But beneath it, fear. Not fear of prison alone. Fear of being seen plainly after years of speaking through rank clearance and reputation. Rourke closed the folder. "I am offering you a way to protect yourself. There it is. You think sarcasm is strength. I think plain language saves time." He placed a pen on the folder. "I need a statement from you. Not a lie. A clarification. You were under extreme stress during those operations, sleep-deprived, treating multiple casualties, working with incomplete information. You cannot verify whether your evacuation notes reflected final command decisions or merely temporary medical recommendations. Natalie stared at the pen. It was black, expensive, heavy, doubt in a metal casing. Rourke continued. That statement does not erase your reports. It places them in proper context. It prevents federal prosecutors from using your old field notes as a weapon against men who made decisions you were not qualified to judge. Natalie looked at him. Men. His eyelids lowered slightly. Commanders. Men. He tapped one finger on the folder. Do not make this personal. It was personal when Private Elias Avery died 37 minutes after being loaded into a vehicle I said he could not survive. Rourke's face went still. Natalie heard her own breathing. There it was. A name she had not spoken aloud in years. A 19-year-old from Ohio who carried a picture of his sister in the back of his helmet band and asked Natalie if his mother would be mad about the tattoo he never got to show her. Rourke said Avery was one casualty in a collapsing operational window. He was a person. They all were. You forgot that when it became inconvenient. Rourke stood. The movement was controlled, but the chair scraped against concrete. You think I do not carry names? I think you carry them like medals. Proof you were near sacrifice. His eyes sharpened. Careful. Natalie almost smiled. Not because anything was funny, because the word finally sounded small. Careful. She had been careful for years. Careful not to react when helicopters passed over Mercy Ridge. Careful not to correct men like Pike too sharply. Careful not to mention why she knew arterial pressure by sight. Careful not to say cross when forms asked for former names. Careful not to let the woman she had been take up too much space in the life she had chosen. Rourke mistook careful for obedience. No, she said. The word landed between them. Rourke's face lost the last of its false warmth. You do not understand the scale of what you are standing in. I understand enough. No. You understand wounds. You understand blood pressure. You understand the small, holy theater of keeping one body alive at a time. His voice lowered. I understand institutions. I understand senators' contracts, classified authorizations, private boards, military pensions, hospital licenses, grant approvals. Mercy Ridge is fragile. Your friends are fragile. Denise Mallory's pension is not untouchable. Samuel Pike's surgical privileges can be reviewed. Tyler Boone is a probationary employee with student debt and no protection. Officer Harlan is brave, but bravery does not pay for rehabilitation. Natalie's hands remained open at her sides. Rourke stepped around the table. You wanted a quiet life. I can let you keep it. I can let them keep theirs. And Jonah. Jonah Vale is a criminal who discovered morality when survival required it. He is alive. For now. Natalie held his gaze. You threatened a patient in my care. I am describing reality. No. You are offering a hostage list. The guard by the door moved again. Natalie did not look back. Rourke came closer, stopping just outside arm's reach. He knew distance. Of course he did. You were never meant for a civilian life, he said. You can wear scrubs, change your name, make coffee in break rooms with women who think staffing forms are combat. But under pressure, you became what you always were. Natalie felt the words strike old bruises. A weapon. That was what she had feared. Not that she could hurt people. Everyone could hurt people under the right conditions. Natalie had feared that her calm meant some part of her had been carved away, that the battlefield had done more than train her, that it had claimed her. Rourke watched the hit land. You are not like them, he said. You never were. Natalie thought of Denise blocking federal agents from the medication room, Tyler making the call while fear shook his hands, Pike saying scrub because Jonah needed another set of capable hands, Officer Harlan locking away the evidence before his skull hit tile, the father in Bay 1 folding over his daughter while the ceiling came down. "No," she said quietly. Rourke's expression shifted, almost satisfied. Then Natalie continued, "I am exactly like them." His satisfaction faded. "I move toward people who are dying. So do they. They just do it without rifles, without command structures, without men like you calling it strategy." Rourke stared at her. Natalie stepped to the table, picked up the pen, and held it between them. "You think medicine made me soft?" She snapped the pen in half. Ink splattered across her fingers. "Medicine taught me where pressure fails." Rourke's jaw clenched. "You have no idea what I can still do." Natalie looked at the broken pen in her hand. "Yes, I do." She raised her eyes to his. "You have been using the same threat for 17 years. The number left her mouth cleanly. 17. For half a second, nothing happened. Then the warehouse changed. A door slammed open somewhere behind the loading dock. Another burst inward near the side entrance. Federal voices cut through the space, sharp and overlapping. "Federal agents, hands where we can see them." The guard by the door reached under his jacket. Natalie moved before his fingers closed. She turned into him, caught his wrist with her injured arm despite the burst of pain, and drove her elbow into the inside of his forearm. The weapon dropped against his coat lining. She kicked it under a shelving unit and shoved him backward into the wall just as 2 agents took him down. Across the room, the second guard tried to run deeper into the aisles. A tactical team intercepted him at the end of the row. Rourke did not run. That would have admitted too much. Instead, his hand moved toward his coat. Natalie saw the shoulder shift. She crossed the distance. He was older but not weak. His grip locked around her wrist when she caught his arm. Pain tore through her bandage. He drove forward with his body weight, trying to turn her into the table, trying to use the old rules of force and rank and size. Natalie let him push. Then she stepped aside. His momentum carried him past center. She trapped his wrist, turned it outward, and used the table edge as a lever. His breath left him in a hard grunt. The small pistol slipped from inside his coat and clattered onto the concrete. Natalie kicked it away. Rourke swung with his free hand and caught her shoulder. Pain flashed down her arm. She closed distance instead of opening it, drove her shoulder into his chest, and pinned him against the table. For 1 second, their faces were inches apart. He looked stunned. Not because he was beaten, because the woman holding him there did not hate him enough to lose control. Monroe reached them with 2 agents. Colonel Nathan Rourke. Monroe said, voice hard, "You are under arrest." The agents pulled Rourke's arms behind his back. Metal cuffs clicked. Rourke's eyes stayed on Natalie. "You think a recording ends this?" Natalie stepped back, breathing hard. "No." Monroe picked up the folder from the table and held it in one gloved hand. "Your voice helps." Tessa Quinn entered from the loading dock, side rein on her blazer pistol lowered but ready. Her eyes moved over Natalie first, checking blood posture, breath. Only then did she look at Rourke. Rourke gave her a cold smile. "Major Quinn, you have no idea what files this touches." Tessa's face did not change. "I know exactly what files it touches." For the first time, Rourke had no answer ready. The agents led him toward the door. At the threshold, he turned his head. Cross. Natalie looked at him. He waited for the name to pull something from her. It did not. "Natalie," she said. The agents took him out into the rain. The warehouse seemed to exhale. Monroe stepped close. "You all right?" Natalie looked at her forearm. Blood had soaked through the bandage again. Ink from the broken pen streaked across her fingers, black, mixing with red. "No." Monroe nodded. "Fair." Tessa came to her other side. You said 17, I noticed. You also attacked an armed guard with a fresh laceration. Natalie looked at her. He was reaching. That was not criticism. Outside, sirens pulsed against the warehouse walls. Federal agents moved through the aisles, securing boxes, checking offices, calling out clear. The medical supply crates stood silent around them, waiting to be sent to hospitals where people would use them for ordinary emergencies. Broken hips, chest pain, children struggling to breathe, the human body failing in familiar ways. Natalie suddenly wanted Mercy Ridge. Not home, not bed, not silence. Mercy Ridge. Tessa saw it. Jonah is awake, she said. Natalie turned. We got the call as we breached. He is groggy, but he asked for Monroe. Monroe's phone rang as if summoned. He answered, listened, and looked at Natalie. He is talking. The drive. Keene. Fallon. Jonah. Rourke's voice. The old reports. Pieces that had spent years apart began fitting together with a sound Natalie could almost hear. Not justice yet. Justice was slower than arrests. But truth had entered the room and refused to leave. By late afternoon, Mercy Ridge looked as if a storm had passed through and left people behind to argue with the damage. The waiting room ceiling was patched with plastic sheeting. A cleaning crew worked around federal markers. News vans lined the street beyond the police tape. Administrators from the main campus appeared in suits that looked too clean for the day. Nurses moved with the strange focus that comes after crisis, doing normal tasks with hands that remembered abnormal things. Natalie returned through the staff entrance with Monroe and Tessa behind her. Denise saw her first. She stood at the nurses' station with a clipboard in one hand and murder in her eyes. You said you would come back, Denise said. I did. You are bleeding again. Yes. Sit down before I make that a medical order. Natalie sat. Tyler appeared with a suture kit, then froze when he realized he had brought it like an offering. I did not know what else to grab. Natalie looked at the kit. That is actually useful. He gave a shaky smile. Dr. Pike came from recovery mask hanging loose around his neck. Vale is awake enough to answer questions. He is asking whether the nurse with the calm voice survived. Natalie looked down at her hands. Tell him yes. Pike stood there another second. Then he said, I documented everything. Clear timeline. No vague language. Natalie looked up. Good. His eyes moved to her arm. Let someone else close that. I was planning to. Denise snorted. No, you were not. Tessa laughed once under her breath. It was the first almost normal sound Natalie had heard all day. Later, after the wound was cleaned and closed properly, after Monroe took another statement, after Jonah Vale began giving names into a recorder with federal attorneys present, after Martin Keene asked for counsel, and Drew Fallon started talking before his coffee cooled. Natalie stepped outside by the ambulance bay. The rain had stopped. Ravenport smelled like wet asphalt and river mud. Officer Harlan was in intensive care alive after surgery with swelling that needed watching, and a long recovery ahead. Tyler had called his mother from the break room and cried where he thought no one could hear. Denise had heard and pretended not to. Pike had gone quiet in the way some men do when regret finally becomes useful. Tessa joined Natalie near the bay doors. Rourke has been transferred to federal holding. Natalie nodded. Good. Your original reports are being preserved as evidence. Legal review begins tonight. Natalie looked at the hospital wall across from them. Families. We are identifying next of kin connected to the altered casualty records. The words landed with weight. Families who had been given clean lies because dirty truth was inconvenient. Mothers, fathers, sisters, wives, people who had built grief around the wrong shape of a story. Natalie closed her eyes. Tessa stood beside her in silence. Months passed, though not gently. Elliot Calder was arrested in a home with ocean views and panic rooms he never reached. Drew Fallon cooperated, then discovered cooperation did not make him innocent. Martin Keene pleaded guilty to conspiracy obstruction and unlawful disclosure of protected patient information. Mercy Ridge's board fired 3 executives, hired outside oversight, and announced reforms with language. Denise called polished horse manure until the first 2 night nursing positions were actually funded. Jonah Vale testified from a secure location after 2 more surgeries and 1 infection that scared everyone more than he admitted. Officer Ben Harlan learned to walk without dizziness, then visited the ER with a cane and a box of grocery store donuts. He tried to thank Natalie. She told him to thank his own stubborn skull. He laughed, then cried, then blamed the head injury. Colonel Nathan Rourke fought everything. He fought the drive. He fought Jonah's testimony. He fought Keene's records. He fought the warehouse recording. But his voice remained his voice. A jury heard him offer doubt like a weapon, heard him threaten a hospital, heard him call the dead collateral to a larger picture, heard Natalie refuse. The conviction did not bring anyone back. It did open doors that had been sealed too long. Families received corrected records. Names were cleared. 3 old medals were reviewed. 2 official letters of condolence were rewritten because the first ones had been built on lies. Natalie received copies of the medical reports she had filed years earlier with her original notes restored. She read them once. Then she placed them in a folder in her apartment next to her nursing license. Not buried, not framed, kept. On a Tuesday night in late November, Natalie returned to Mercy Ridge for another night shift. The automatic doors opened to the same smell of bleach coffee, damp coats, and human trouble. The ceiling had been repaired. The security cameras had been replaced. The ambulance entrance feed no longer flickered. The coffee still tasted terrible. Denise stood behind the nurses' station, reviewing a staffing sheet with the expression of a woman preparing for battle. "You are late," she said. Natalie looked at the clock. "I am 4 minutes early." "Exactly. You are usually 10 minutes early." Natalie hung her jacket on the chair. "Traffic." "At this hour." A possum stared me down near the South Road. Denise nodded seriously. "Ravenport Wildlife has no respect for medical professionals." Tyler walked by carrying linens, steadier now, less apologetic. He wore his badge at the right height. "Evening, Natalie?" "Evening." He hesitated. "We have a new tech starting next week." I told him night shift is not as scary as it looks. Denise looked over the top of her glasses. "You lied to a new hire." Tyler smiled. "I said not as scary. I did not say safe." Natalie almost smiled too. Dr. Pike came out of Bay 4, holding a chart. "Natalie," he said, "can you look at the patient in 2? Something about the respiratory pattern feels off." He handed her the chart without making a speech. "No correction, no performance, just trust." Natalie took it. "I will check." At 3:08 a.m., the ER doors opened. For half a second, everybody that had lived through that morning months earlier felt the old memory pass through the room. Natalie turned. A man rushed in carrying a little boy wrapped in a blanket. The child's lips were pale. His breathing came in thin, sharp pulls. The man's face was wild with fear. "Please," he said. "He cannot breathe right." Natalie moved toward them. No rifle, no warehouse, no Rourke. Only a child, a father, and the narrowing space between panic and action. She took the boy gently from his father's arms. "Bay 2, she said. "Now." Tyler cleared the path. Denise reached for oxygen. Pike looked up from the chart and followed without needing to be called. Natalie placed the child on the bed, warmed the stethoscope in her palm, and listened. The rhythm was wrong. But she knew wrong. She knew how to meet it. The boy looked up at her, frightened and fighting for air. Natalie lowered her voice. "I've got you. Outside Ravenport slept under dark hills and wet streets. Inside Mercy Ridge, machines hummed, shoes moved over tile, and Natalie Reed stood at the bedside with steady hands. Not hiding, not running, exactly where she chose to be.